The statistics remain stable. For the third day in a row, the number of confirmed cases remains 10, with 5 of those now given the all clear. But according to the government, this will not be the case over the coming days. Today's press conference was chaired by the Minister for Public Health, Dr. John Cortes, and Public Health Director, Dr. Suhail Bhatti. Dr. Cortes said we will have more cases, the hospitals will fill up, and we will have deaths. Dr. Bhatti confirmed there have been 630 calls to the 111 medical hotline in the last week, adding that this was pretty much confirmation that the virus was among us. He anticipated that someone will fall critically ill in the next few days, and St. Bernard's was quickly becoming a 150-bed infectious diseases hospital. 50 elderly patients are being moved out and into temporary wards in Mount Alvernia and Bella Vista Day Centre.
The work has been carried out or is in the process of being completed in Mount Alvernia, which will convert the ground floor, or part of the ground floor has been partitioned and provisioned to be able to take residents, we call them residents rather than patients, and Bella Vista being a day facility. The day facility is no longer in operation because the elderly are encouraged to stay at home, so therefore the facilities there have been converted to take residents. That's an extra 50 beds. The intention is that St. Bernard's Hospital will be the acute hospital for COVID patients, with the most intensely, those requiring most intense care in the ITU or in the second ITU, which is the old day surgery, not that old, but the day surgery unit. And then there is, I think it's John Ward, which is now being dedicated to COVID patients. And I believe they're in the process of even making a further ward available.
The temporary wards and field hospitals will require additional nursing staff, with negotiations underway to contract medical service firms in UK for the supply of the extra nurses. With critical care essential in the treatment of the COVID-19 virus, the number of ventilators available in hospital is set to increase shortly from 24 to between 40 and 50. Asked by GBC about a lockdown, the minister said this would be on the advice of public health, but people should in any case be on voluntary lockdown already. He said Cabinet would be meeting to discuss further possible restrictions on freedom of movement.
We are taking serious measures. I think the step that we took in locking down our over 70s was probably unprecedented. I don't know whether any other country has done it, even though it's recommended. So we are taking strict measures. We have closed down businesses. We have restricted agglomerations of people. So we have taken measures which we feel suit our community best. Remember that we're not looking at a huge country where one of the problems there is the movement of population from cities to rural areas and spreading the virus in that way. We cannot be compared to a country in that respect. We can be compared to a city. And therefore, the measures that we are taking are following public health advice, correct and custom-made for Gibraltar.
If it was down to me, I'd have done it long before the virus came here. Yeah, 4 weeks ago would be the right answer, I think. But if I'd stood up 4 weeks ago and said no one should be allowed to go out, no mass should be cancelled, there should be no shopping, I don't think I'd be sitting here today in the job that I have. But I have to tailor it according to circumstance. And the circumstance that we've done, I think, is appropriate for Gibraltar.
Minister Cortes said the government was taking serious measures which it felt suited the community best, and described the lockdown for over 70s as unprecedented. He added that by and large people are listening to government advice. People were staying at home voluntarily, and urged them to carry on doing this and only leave the house to get food and medicine if they really have to. Dr. Bhatti said the GHA does not have an infinite supply of swabs, and priority was being given to healthcare and frontline workers so that they could be cleared to return to work. He said Public Health England was developing a blood test to analyse people's immunity to COVID-19, which would be transformational for our ability to determine who can continue to work. From an economic perspective, And after a 3.5-hour meeting today to discuss the impact of the disease on business and jobs, Dr. Cortes restated mechanisms were required to protect employees. But with a rainy day fund of £150 million and a borrowing ceiling of £500 million, was it sufficient to sustain the salaries of all those whose jobs may be at risk?
It's early days because we cannot tell how much, firstly, the cost of dealing with the disease, which must be our absolute priority now, will be, and then those packages that have to be put in place in order to sustain the economy. I think it's premature at this point in time, but I think people should be reassured, and they will have known after this morning's meeting that the government is absolutely committed to pulling through, not just through from the point of view of health, but also from the economic perspective.
With just 5 active COVID-19 cases at this time, the public should not think that Gibraltar is not being affected greatly. Both Dr. Cortes and Dr. Barty are of the view that we should not be surprised when infections increase, adding starkly that it's coming.
There are agencies, and we're working very hard, and we are very positive at the moment that we will be able to